Good afternoon, ladies and gentlemen. We are Oculyte, and we are here today to introduce you to the future of healthcare. Heart disease and stroke are currently the top leading causes of death worldwide, and researchers expect the number of deaths associated with these conditions to triple in the next decade. This means that in 2025, every 12 seconds, someone will die of heart disease and stroke. Disparagingly, medical experts say that 80% of these deaths could be prevented if they are detected early enough. This turns out to be very difficult when people only attend doctor's appointments after something has already happened, and not as a preventive measure as it is in the current trend. In the past decade, healthcare was centered on reactive facility-based products, which have been replaced by today's real-time medical platforms. We conducted extensive research regarding future developments such as hyperconnectivity, the population's increasing health awareness, and especially the significant transformation of the healthcare industry. We discovered that in the future, this sector will be shaped by localized solutions and preventive measures. As such, there is where we can have the most impact in tackling the world's greatest silent killer.
Recent ophthalmological studies have shown that there is a direct relationship between visual markers on retinal scans and heart disease and strokes, proving the old saying that the eyes are the window to the heart. By creating an AI-assisted algorithm to compare scans of a person's retina, we can predict various personal characteristics as well as pre-diagnose various diseases, including our focus, heart disease and stroke. Therefore, our team has sought a solution that prevents the increasing number of heart diseases and strokes to the use of AI technology in a product that carries out health checkups in a more practical, easy, and time-efficient manner. We created a convenient and reliable way for our customers to self-perform a retina scan where our AI technology will provide an accurate diagnosis in order to check for heart-related risks. Once they open the app, our customers are provided with the opportunity to select from our freemium and 2 subscription options, where the user will be provided with a list of the variety of features that each option offers. After their selection, they will be redirected to our sign-up page where our customers can create their personal account and input their chosen payment method. Once the sign-up process is complete, our customer uses their smartphone to perform a retina scan, where our AI algorithm analyzes and interprets the results more accurately than a medical professional. Then, the results are shown to the user in an easy-to-understand format, as well as AI-provided recommendations for next steps based on the diagnosis. In addition, the user will also have the option to set up family sharing and enable or disable notifications. If the results indicate a potential medical emergency, we will provide the option to book a virtual appointment with one of our doctors directly from the app, and a detailed report will follow. Next, in order to incentivize our customers to regularly perform the scan, we designed a point reward system that is designed to support customers' healthy lifestyle. And finally, to remind customers to perform the scan, we have included push notifications in our app. To answer the questions that's on your mind right now, we will explain the origin behind the retinal scan technology in the mobile phones. The modern-day facial recognition scans to unlock our phones have proven to be inconvenient because of the mandatory mask wearing in the global pandemic that changed all of our lives. The so-called advanced biometric security methods that mobile phones manufacturers incorporate in their phones are now considered outdated as the industry is prepared to take this technology to the next level. Industry tech giant Apple has recognized these needs and has already filed a patent in late 2019 for a developed retinal scan to incorporate in their smart products.
When designing this product, we envisioned that at a time when heart attacks and stroke are the largest causes of death in the world, to provide an inexpensive, convenient AI method to prevently diagnose this condition in people over the age of 35 in an overstressed medical environment. In order to make this vision a reality in our lifetimes, our strategy when developing our mobile app was aimed to make this product accessible for everyone, allowing us to leverage an easy and convenient way to check their current heart health status by providing a straightforward user experience. These UX considerations are necessary due to the wide range of ages and technological experience of our users.
As our idea is based on an immensely innovative concept, at the current point of time, our competitors break out into two different camps. They either operate in the same healthcare sector as us, or utilize similar technology. To be precise, we are the first company in the market that is focused on developing an advanced AI algorithm to prevent heart disease and stroke using the retina scans of our customers' phones. Our competitors include Google Deep Health, who are developing a similar AI and attempting to solve a completely different problem, namely the prevention of eye disease and blindness, which creates a market gap opportunity for us. As an additional competitor, although not as threatening, we also consider the conventional medical professionals who are specializing in heart disease and stroke prevention. However, our research illustrates that patients most often refer to these doctors after they have suffered health-related symptoms, which severely limits the patient's options moving forward, whereas our concept is prioritizing early diagnosis and preventative solutions. From the moment Oculyte achieves brand recognition, some of our powerful competitors will without a doubt attempt to follow our lead and incorporate our idea into their own products. However, we expect to have already attained exclusive partnerships with the Moorfields Eye Hospital and the Oxford Eye Hospital in the UK. Our unique access to their extensive databases will grant us a first mover advantage and will aid us to achieve a substantial market position in the race to commercial success. To preemptively address a few concerns you may be feeling right now. Yes, it is completely legal in the UK for these hospitals to share their data with a third-party entity as long as that data remains anonymous and is utilized for the future health benefits of their patients. We will obtain these exclusive partnerships due to data privacy concerns, which is a massive issue in the UK. Unlike existing industry giants such as Google, who have experienced their fair share of data sharing scandals, Oculyte is a startup that is following the future trends of data privacy concerns of the general population. In addition, we fully commit to incorporate the highest security measures possible to protect our collected data and privacy.
Mapping helps us to identify how the solution creates value for our customers. In fact, it allows us to uncover and understand the customer needs that have to be satisfied by the product. By doing so, the product team does not miss the opportunity to serve the customer's underlying true needs. We can use the road mapping process to not only discover the demographics of the target customers, but also the deep, real reasons of why they will use our product. This technique allows us to go beyond conventional data gathering and discover more detailed customer needs. Our collected data will give us insights that outrun simple demographic data, such as age, by telling us if, for example, a customer was already suffering from previous diseases. We will also be able to ascertain which activities and habits negatively contribute to a higher risk of heart diseases. In addition, we will come across challenges such as customer acquisition and customer churn, which mapping will allow us to be prepared for and come up with solutions. Our engineering team is responsible for the coding of our AI, as well as feeding it the retina scans received from the Moorfields and Oxford Eye Hospitals. After the initial feeding, we will complete a case-by-case analysis by ensuring our AI is able to outperform a medical professional's diagnosis using old case studies as a test. After reviewing the performance, we will feed the AI more retina scans and complete the analysis for a second time. If the performance results are satisfactory, we will begin our beta testing process. Following the results of our beta test, we optimize the AI performance if necessary and officially launch the app. We begin measurement of our KPIs and conduct constant software development and app improvements. The app development team is responsible for every step of the design thinking process, optimizing our app for consumer use. In order to do this, our team will utilize user research, updating information architecture, and constant post-feedback updates to the software.
As our company progresses, we will be revisiting our roadmap to measure the impact according to our data-driven KPIs. In the beginning, we will be focusing on the conversion rates between downloads and signups, which are crucial in understanding our impact on the individual users. If this KPI remains low, we would need to revisit user data to optimize the onboarding process as well as accelerate marketing effort deployment. By observing the number of retina scans completed, we can measure the quality of our AI algorithm as well as our overall impact. If these initial KPIs remain low, we will need to revisit our marketing plan as well as redesign our UI. By quantifying the number of functions utilized, we can estimate how user-friendly our service is, as well as the amount of trust our users place in our service. If the rate of upgrades and used functions does not increase in the initial 6 months following our public launch, we would need to further adjust the UI/UX design to clearly express the benefit of our scans. We will also increase the number of push notifications to remind users about what they gain by completing our scans to avoid contracting heart disease or suffering from a stroke. Lastly, the number of scheduled doctor appointments through the app will show us the user's interaction within the app, and if not enough appointments are made, we will need to restructure our clinical network. In summation, through comparison of these KPIs, we can identify which aspects of the app and AI software we need to further develop, which aspects are performing perfectly, and what is causing and preventing subscription upgrades, as well as factors influencing recommended use. Including the UI/UX development team in the process of collecting and analyzing our KPIs will be key to move forward quickly, constantly improve our product roadmap, and make data-driven decisions aimed at increasing the user experience based on our findings. We now officially offer you the opportunity to help us painlessly prevent the death of many, which may include yours or someone that you care about, by investing in Oculyte and changing the face of health in the next decade. If you're still in doubt, we'd like to bring to your attention that during this presentation, 60 people unfortunately died of cardiovascular disease which could have been prevented. Invest now and save lives. Oculyte, know it and prevent it.